Can you explain to us the connection of cases that are connected to Bin's Nails outbreak?
Okay, so as of 8:48 this morning on Friday, June 26th, I'm just trying to keep our community continually aware of the investigation as it unfolds. As of this morning, we now have 6 workers that have tested positive at Bin's Nail and Spa, and 1 partner of an individual who has tested positive. If you remember, one of our first cases was a mother and child and a worker at Rustic Spud, a local restaurant in Kingston. Subsequently this morning, we have 1 other worker, behind the scene worker, that has tested positive, and a total now of 18 cases have turned to be positive. So we're seeing transmission outside of the initial contacts to spouses and to partners, and this is typically happening every 3 to 5 days. So this has most likely been going on for roughly a week in our community. Some of these individuals were workers in healthcare settings, were workers in correctional facilities, and hence the risk to the community was very high that this could have spread out into vulnerable populations. I'm glad at present that everyone now is aware of the risk in our community. There were 500 people that had gone to this facility since its opening on June 12th, and those 500 people have been asked to quarantine themselves, to monitor for symptoms from 14 days from the visit that they had at that facility on Gardner's Road. We have contacted everyone that's tested positive. If you haven't received a call as of yet, it's because either we haven't received your test and or you've been negative. But our main action now is to ensure that anyone that's tested positive is contacted, and then our investigations unfolds on anyone that has tested positive. On average, right now, our cases have had 10 other contacts. So although we know 500 people had visited and gotten services at this personal service setting over the last 2 weeks, we now know there's 180 additional people that we're monitoring in the community. So this is one example of how COVID-19 can try to sneak into our community, that if this wasn't caught early, it could have propagated into our vulnerable care setting. And from one setting alone, we're now following 680 people. This has a significant economic impact on our community. That 680 people should be off for 14 days. It has repercussions for the businesses. And we have tremendous lessons learned from this. Whenever you're going into a personal service setting, you should be masked. You should ensure that the person providing the services is masked. If they touch their mask, they must wash their hands immediately. Before they touch your body, your nails, your hair, they should be washing their hands, and you should see that occur for 20 seconds. And for these settings, they should be scheduled visits. The visit should be documented with a contact phone number or email if you've attended these settings to ensure that if an outbreak occurs, we know who to contact and to warn of the risk of this COVID-19 virus. This is not unexpected as the economy opens, that this can occur. And I'm just happy that this was caught early. It really tells us as a community that we have to adhere to the best practices. Our website at kflaph.ca has excellent resources for all businesses. We have an audit tool. I suggest every business today review that audit tool, apply it to their setting. I suggest to everyone in the community, if you're going to any personal service setting, that you wear a mask. Today, our team is reviewing whether we should be mandated masking in public for everyone in our community. Due to the economic impact of this, we don't want setbacks. We want our businesses to stay open. We want to support our businesses, but we want to do so safely so that this virus doesn't spread. We're all in this together, both businesses community, the health sector, and the key aspect of this virus, if we're going to learn anything, is on prevention, prevention, prevention. Right now, no one has had to be in the hospital. But if this had spread, I could easily anticipate that we would have had patients admitted to the hospital. We would have had infectious disease spread within vulnerable settings. So key lesson learned, let's learn from it, let's apply the best practices, and learn from this event.